Good morning. My name is Mary Gwen Leonard, and I'm just going to be doing my video journal. Today is February 4th, 2019. And according to Judson Harrison definition, consent is a written, verbal, or implied permission that a patient gives to a physician, allowing them to be examined and perform clinical tests that could be used to help diagnose their condition. When an implied consent is not enough, an informed consent is then warranted. And this is when a patient gives a written consent to have a surgery, a signed consent, to have surgery or be tested for any other type of condition like HIV, or give informed consent for blood transfusions or any other invasive type of procedures. They would need to have informed consent. For a person to give consent, they must be cognitive, meaning they must be, of sound mind. So therefore, a person must have capacity in order to give consent. So those two things have to go together. But before you can actually give consent, you have to be capable of doing so. Having capacity means that a person can understand and use the information that is provided to make a decision. In a video that we saw on capacity, it's indicated that for a person to have capacity, 4 elements must be present. The first one being that the person understands what is being discussed, such as their medical situation, understanding their illness, and what is being told to them. So they need to understand. That's the first element of it. The second element, a person must be able to express their choices between the different options that are available to them, and to be able to decide on them and the best options for them. Third, a person should be able to appreciate the facts that are being given to them by the healthcare professional, physicians, nurses, and understand how those facts apply to their situation and how those facts can affect them, and be able to state what would happen if they do not accept the facts and the consequences that may follow. So they need to understand and appreciate the facts that the doctors or nurses are giving to them. And lastly, a person must be able to apply reasoning to their situation, meaning be able to understand the what's going on and be able to reason or say they understand it. Be able to form a conclusion from the facts that have been presented to them, be able to compare the different options and apply those choices that are in line with their beliefs and values. Therefore, capacity is the ability for patients to take information that is given about a health condition, the treatment options, and be able to make a choice that is agreeable to their values and beliefs, knowing that this is beneficial to their care. So they have to be able to understand their situation, understand what the doctors are explaining to them, the facts of that situation, and then take those options that the doctors have given them for their treatment options and apply those to their situation, and put it in line with their values and beliefs to make a decision. The video also states that any condition that affects a person's cognition can potentially impair their capacity. A person lacks capacity if their mind is impaired or disturbed in some way. Therefore, it means they are unable to make decisions or give consent for care. For example, according to the law, all adults are presumed to have capacity to make their own decisions. So when a decision is about medical treatment, it is understood that an adult can make sound decisions that they may feel is going to be beneficial to the process of their care. So when the decision is about a medical condition, which I've already stated, they'll understand the condition and to be able to make decisions according to what they need to do about their care to benefit their care. So the question of capacity come about when a person refuses treatment that is important to their health, which may then cause them to be at harm. When it is deemed that a person is not mentally stable or their mind is disturbed or impaired in some way, this person is considered incapable to make decisions at the time that decisions need to be made. For example, a person may not have capacity if their brain or mind is impaired due to mental conditions such as dementia, bipolar disorder, schizophrenia, or a person that suffers from any neurological illnesses such as Alzheimer's disease. Also, if a person has suffered from a catastrophic health condition such as a cardiac arrest, a stroke, or any other brain damaging conditions that limit their ability to make capable decisions. That's when a question of capacity come into play in healthcare. A person's capacity should be assessed a person's capacity should be assessed each time they need to make a decision about their care, because a person's capacity may change from time to time, especially when you're in a hospital setting. This is according to an article I read by Mark Tuzzi. For example, if a person needs to consent to having a procedure done, a psychiatrist or a physician that is involved in the case should make sure to assess the patient's capacity to determine that they understand the information provided about the illness, the treatment options, risks and benefits of treatment, or refusal of treatment and plan of care before they give consent. They need to understand those things. The video on capacity talks about the tools that could be used to assess capacity. Such tools are MacArthur Capacity Assessment, the assessment of capacity for everyday decision making, and a mini mental status assessment test. Those are some of the tools that can be used to assess a patient's capacity. If a person lacks capacity, the healthcare professional should know if they have a surrogate decision maker, such as a spouse, an adult child, or even their parents can be a surrogate if that is known. So let's go into Mr. K's scenario. Mr. K is a 80-year-old man who has insulin-dependent diabetes, and he has a history of heart disease, moderate dementia, and has chronic disease. And he basically lives alone, and as is stated on the scenario, his neighbor comes and check in on him at times. But at this one time, his daughter his daughter comes to report. His daughter says that he is compliant to his medication. He doesn't like going to the doctors. His medical workup. His daughter is accompanied. His daughter is accompanied by. He is accompanied by his daughter to, who reports he does not like going to the doctor. So he actually had complications with his condition. He ended up going into a medical facility, and the daughter is explaining that he is complying with his medications, but he doesn't like going to the doctor. So in Mr. Case's case, the question comes to play where it asks him, they tell him about his condition. Mr. K can name the president, but states the year is 2000, and his healthcare provider, so then when you tell him about his condition, what he needs to have done, about especially his diabetes, and he needs to have dialysis done. The healthcare provider said to him that he needs dialysis, and he quickly refuses. I'm sorry, I'm stuttering. So in that case, he refused treatment. So now the healthcare provider is left to wonder, is he capable of making that decision right then and there? So in Mr. K's case, he has been diagnosed with dementia. He is also, and although he is alert to he is alert and oriented person. He doesn't know the year that he's in. He does know that he's in a facility, but he doesn't know which facility that he's in. So therefore, I do not believe that he is fully cognitive to understand the severity of his condition, and in making a capable decision on his treatment. So in that case, Mr. K should be assessed for the 4 elements of capacity to see if he is capable to making decisions in his own on his own behalf. You need to understand, does he understand what is being told to him about his condition? Can he express his choice on the different options available to him in treating his condition? So these are the things that we need to assess, the 4 elements. Does he appreciate the facts that are being presented to him and apply those facts to his beliefs and values, and understand the consequences of not accepting the facts? And what would happen if he does not go through his dialysis? Like, if the consequences, would it cause him to lose a limb? Would it cause him to be have ulcers, diabetic ulcers, or even worse, if he continued to refuse dialysis, it could lead to death. So those are some of the consequences that he may end up being faced with by him refusing dialysis treatment. So therefore, we need to assess his capacity to make sure that he is able to make that decision to refuse. At that point, I would decide what the healthcare provider should therefore make sure that there's a psychiatrist or some physician be asked to come and assess Mr. K to deem him competent or incompetent to make a decision if he want to have dialysis or not. Second, Mr. K or his daughter should be asked if he has a living will, which may state that his daughter is his medical POA, which at that point, all decisions will be directed to his daughter about his care. Medical decisions, the question lies, it says, how did I come up with my conclusion? How did I come up with the decision of how to treat Mr. K, I believe. And I say that medical decisions are assessed by Mr. K's ability to understand his illness and his treatment options. So since Mr. K refused dialysis, I'm unsure if he understands the benefits, the consequences, and risk of his decision. And therefore, that's why a psychiatrist has been requested to actually assess his ability to make any decisions in regards to his care. Once that assessment has been done and it is deemed that he is incompetent, then we're hoping that his daughter, or there is a power of attorney. And if there is not a power of attorney, there is another option where it's an ethics committee that actually appoints or talk out his case, and at the end, I believe they will talk and decide what the best options would be for Mr. K. So that is all I have for now. Thank you so very much.